Why zero harm fails in most health systems, yet it worked at VA. Most health systems talk about patient safety and most track safety events. But when you are operating at scale, safety is not just about having the right protocols. The Veterans Health Administration faced that exact challenge. To solve this, VA asked a different question. How do we design a system where harm is structurally harder to occur? It is about alignment, culture, and trust. Today's case looks at how the Veterans Health Administration pursued a zero harm approach across more than its 1,200 facilities without turning safety to a compliance exercise. Welcome to Healthenomics. I am Dr. Ayoub Ashraf. I work in healthcare strategy and execution. In this series, we look at real success stories from the large health systems that how leaders deal with complexity around quality, safety, access, and cost. Keeping patients safe and preventing harm is not just a moral obligation, it is a leadership capability that can be developed. Now, let's talk about the real problem. VHA is the largest integrated health system in the United States, serving over 9 million veterans across its hospitals, outpatient clinic, and long term care facilities. With that scale comes complexity. And despite having strong quality infrastructure, the organization still experienced variation in safety outcomes, especially in high risk areas like pressure injuries. The issue was not that people did not care about safety. Issue was alignment, that how do you get hundreds of facilities to move in that same direction using the same language without creating fear or blame. That is where zero harm approach came in. Zero harm does not mean zero mistakes. It means designing systems where preventable harm is anticipated, surfaced early, and stopped before it reaches the patients. Instead of launching multiple quality initiatives at the same time, leadership made a deliberate choice. They focused the entire system on one national priority, and that was pressure injury prevention. It simplified the message, it gave everyone a clear target, and it removed the noise that often comes with competing priorities. Once that focus was established, the next challenge was execution. Leadership invested heavily in making sure that communication was consistent across the system. The same expectation, the same terminology, the same supporting material at the same time. And they worked to reduce variation in how the work was supported. Evidence based tools were standardized, documentation workflows were aligned, dashboards were designed so that teams could see how they were doing without waiting for retrospective reports. What actually made this approach different? It did not feel a top down approach. Teams were brought together through virtual learning collaboratives and communities of practice. Frontline staff could shape what was working, what was not, and what barriers they were facing. This was not about enforcement, it was about learning together. Another important decision was how leadership approached culture. From the very beginning, the message was clear. This initiative was about improvement, not about punishment. Culture principles were reinforced intentionally, and psychological safety was treated as something that had to be built, not assumed. When staff feels safe to speak up, something important happens. Incident almost always are reported, problems surface earlier, and harm can be prevented before it occurs. Over time, leaders began to see a shift. That was a greater engagement in safety conversations, more participation in learning forums, and increased visibility into what risks actually existed. Another subtle but critical factor was integration. The zero harm effort was not running on the side, it was embedded into VHA's high reliability strategy and nursing leadership priorities. That sent a strong signal that safety was not a project, it was part of how the organization operated. The real lesson here is not about pressure injuries. The lesson is that large systems do not change through slogans. They change when leadership simplifies priorities, standardizes support, and makes it safe for people to speak up. If you are leading a health system today, there is a question worth asking. Can your organization align thousands of employees around one quality goal without fear? If answer is no, this model shows that it is possible. This case was presented at the American College of Healthcare Executives Congress 2025 by leaders from Veterans Health Administration, Dr. Edward Yekel, Dr. Jennifer Strawn, Christian Agen, and Nicole Manuel. I want to clarify one thing. I have no financial, professional, or advisory relationship with the organization or individuals mentioned. Thank you so much for your time.